Prostate cancer still remains the second most common cause for male cancer death in the UK, and every year over 40,000 patients are diagnosed with prostate cancer.
By working as a multidisciplinary team, we can bring together the expertise of our clinicians, our academics, our researchers in order to better treat our patients.
We really need a multidisciplinary approach to identify what is really going on with prostate cancer and to manage the patient in the best possible way. King's Health Partners is an academic health science centre in the UK linked to 5 different hospitals in London. Our hospitals see about 1,200 newly diagnosed men with prostate cancer each year. We have set up our prostate cancer program, which really is a link of all the people involved at King's Health Partners who work on prostate cancer.
Our prostate cancer program is unique. It brings together a multidisciplinary team of urologists, oncologists, scientists, engineers, computational sciences, epidemiologists and nurses. And by working together, we can actually translate science into better patient care. We are looking at nearly 400 to 500 radical prostatectomies a year. We also offer other treatments such as brachytherapy, radiation in all its modern forms, focal treatments. We have a survivorship pathway where patients are looked at each part of their journey. And very importantly, we have a prostate cancer research center embedded within our prostate cancer program.
Research really drives our entire prostate cancer program. Because we meet once a month, we can make sure that all the different disciplines that are required to make a study successful can be actually linked together and will also work together.
Patients are recruited into our research programs for prostate cancer via us screening the multidisciplinary team meetings, looking at the clinic lists and the patients who are coming through, and the patients can also look at the website and see what research projects we actually have running here at the hospital. If patients would like to become part of our research projects, we then bring them in and we take their consent for their bloods and for their clinical information. This then becomes part of the King's Health Partners Biobank for research in the future.
I'm interested in the role of the immune system in prostate cancer. The immune system varies between patient cohorts. So for instance, patients who present with early or localized disease versus those patients that present with advanced or metastatic disease. So we want to know, are there any differences in their immune system? We've seen some interesting results which could indicate that we can detect certainly immune cells in patients' blood, which normally you would only find within the tissue or within a tumour. And potentially this could be a new marker by which we can monitor prostate cancer patients. We work together with the epidemiology department, both in how we design our studies, because they have the right expertise in designing of cohort studies, but also in analysing large data sets.
Our metal study is probably a very good example of a patho-epidemiological study. Metformin is a commonly used drug for diabetes, which in observational studies has been shown to potentially slow down prostate cancer progression. What we're doing here is we take tissue from the biopsy when a man is diagnosed with prostate cancer, and then we randomize them to metformin or placebo. They take the drug or the placebo for 4 weeks, and then we have the tissue from the radical prostatectomy. We can try to see what biological pathway or marker is potentially affected by this drug. Whilst one way of trying to identify how metformin is affecting prostate tissue is using blood and tissue samples, another way is to actually use imaging.
Within the prostate cancer research program, we have a large range of imaging capability spanning the preclinical development through to patient research and through to translation into clinical practice by a combination of our high-resolution morphological techniques such as MRI and our molecular and functional imaging techniques including PET, which we combine with PET MRI scanners and improve overall diagnostic accuracy through the synergy of these techniques in one scanner. We're interested in combining both high-resolution MRI with some functional MRI capability together with some novel PET tracers to get a better overall accuracy of the spread of cancer within the prostate gland itself, in the hope that we will be able to at least reduce the number of biopsies a patient may require when they're diagnosed with prostate cancer. All the time that the imaging of the patient is improving, the surgeon can be much more certain what the best next course of treatment should be.
have a great team of very innovative scientists that really takes surgical research in prostate cancer to the forefront. Recently, for example, we have worked with 3D models of the prostate, which can tell us exactly where the tumor is. We have even introduced a device called the translucent device, whereby we can look inside the patient, literally putting an iPad over them. And finally, we have been working on developing the sense of touch. This is called haptics. We have designed and worked with engineers to develop the ProGlove. And all this translates, I think, in the end to better patient care.
The prostate cancer program brings together all those specialties that treat prostate cancer, and this is the only way by which we can develop those treatment plans and improve outcome ultimately.
Our patients, together with our education, are better understanding their role in translational research and actually what they can do to benefit future patients.
Our goal in prostate cancer research is to find ways to distinguish indolent from fatal prostate cancer to improve survivalship for all men with prostate cancer.